coming. Do you need any help? Everything is okay?
A bit tired, but I'm alright. Just taking things as they come.
Nice to meet you. My name is Nurse Aisha. I will be helping you through your admission process today. How are you feeling?
A bit tired, but I'm alright. Just taking things as they come.
That is completely understandable. We will go at the best that is comfortable for you. If at any point you need to pass it, just let me know. I would like to ask a few questions to better understand your condition and how we can support you. Is that okay?
Yes, go ahead.
Can you describe any symptoms you have had lately?
Mostly pain, especially at night. I get breathless even when I'm just sitting.
How would you rate your pain right now?
Maybe a 6. Sometimes it can go higher.
How have you been coming emotionally?
Some days are harder than others. I worry about my family.
That is very natural. We can arrange for counseling or supportive service for both you and your family if you would like. It is important for us to understand what matters most to you. Do you have any preferences for your care?
I do not want aggressive treatments, just comfort. And I would also like my family around me.
We can support with that. Have you discussed an advanced care plan?
I have talked a bit with my daughter, but nothing formal.
We can help guide you through that and clearly document it. Who will be your main supportive person during your stay?
My daughter, she will be here most of the time.
That is good to hear. We will make sure she is included in discussion if you want her to be. Thank you for sharing all of this with me. I know it is not easy. We are here to support you every step of this way.
Thank you. That means a lot.
If you need anything at all, just let us know.
Miss Sarah's heart failure has reached an advanced stage. Despite treatment, her condition is not improving. At this point, we will focus on palliative and terminal care to keep her comfortable.
Is there nothing else we can do?
We will continue supportive care, but the priority now is comfort, pain relief, and emotional support. The nurse will guide you through everything.
Hello, Miss Sarah. I am your nurse today. I am here to keep you feel comfortable and supportive you. I can see you're having difficulty breathing. I will help you feel more comfortable now. I am going to elevate the head of the bed to semi-fetal position to help her breathe easier. I ensure that patient is properly supported with pillow to minimize alignment and prevent strain. Miss Sarah, are you in the pain? Alright, I will give you medication to help you relieve your pain and keep you comfortable. I will perform the 5 right medication demonstration, right patients, drugs, dose, routes, and time. I will check and adjust your oxygen to improve your breathing comfort. I will monitor oxygen therapy to ensure it is effective and prevents dryness or discomfort.
Aseptic technique. Aseptic technique refers to the practices and procedures used by healthcare professionals to prevent the introduction of pathogens into the patient's body during medical procedures. Aseptic technique prevents infection and ensures patient safety. It includes using sterilized equipment, maintaining a sterile field, and applying antisepsis to reduce bacteria. When should aseptic techniques be used? Intra-fluid or medicine preparation and administration, simple and complex wound dressing, urinary catheter insertion, intravenous cannula or central venous catheter insertion and maintenance, drainage bag emptying or changing, surgical procedures, and collecting swabs and specimens. There are two types of aseptic techniques: medical asepsis and surgical asepsis. Medical asepsis or clean technique reduces the number of microorganisms and prevents their spread, whereas surgical asepsis on the other hand creates a completely sterile environment using sterilized instruments. Medical asepsis includes hand hygiene, which is regular hand washing, and disinfection, the use of disinfectants to clean surfaces, equipment, and other items. Surgical asepsis is the process of creating a completely sterile environment free of all microorganisms. And sterilization is an example of surgical asepsis. Use of sterile instrument is important.
In palliative care, comfort is our priority, including hygiene and skin protection. I am providing oral care to prevent dryness and maintain comfort. I will assess the skin integrity and reposition the patients to prevent pressure ulcers.
Infection prevention and control. Common sources of infection includes environments, other clients and attendants, people in the community, and also healthcare delivery personnel. There are several necessary steps that must occur in order to have infectious disease. These are called as a chain of infection. The universal precautions. The universal precaution refer to wearing non-porous articles to avoid contact with patient bodily fluids. And these are a few of the standard precautions that we are advised to follow. PPE kit supplies include glove, mask, coverall, head cap, shoe cover, and goggles. Mother.
Even though Miss Sarah may not respond much, she may still hear you. You can speak to her and hold her hand. You can stay with her, talk to her. If not any change, please let me know. I am here with you. You are not alone. Right now, our focus is hair comfort and dignity. Aina, how are you holding up?
I'm trying to be strong, but I can't see her in this situation.
This is completely understandable. This is a very difficult time. You don't have to carry it all on your own.
She's always been very independent. Now, she can barely move on her own. I don't know what to do for her anymore.
Being here for her already means so much. Your parents, your boys, those are incredibly comforting to her, even if it doesn't always show.
Well, the doctor said her condition was advanced. What does that really mean?
It is me. We are focusing on keeping her comfortable and maintaining her quality of life. This includes management her pain, helping with her grief, and making sure she feels supported emotionally.
So, we are not trying to cure her anymore?
At this stage, the goal shifts from caring to caring. We want to make each day as comfortable and meaningful as possible for her.
I don't know if I'm ready for this. I feel like I should be doing more.
It's very common to feel that way, but winning words listen to her and for you to hear who wishes that is doing something important. Would you like to talk about what matters most to her or what she's experienced about the
She said she doesn't want any aggressive treatment, just to be comfortable. And she wants us to be close.
We will respect that. We can also help your formula those wishes if you would like. So everyone involved in here understands.
What should I expect in the coming days?
There may be changes in her energy. We will mentor her closely and keep you informed every step of the way.
Will she be in pain?
We will do everything we can to manage her pain. If you notice any sign or discomfort, please tell us right now.
Sure, I think that might help. Thank you.
We are doing the best you can in very hard situations. Be kind to yourselves.
I'll try.
If you are ready, we can go visit with her together.
Sure, let's go.